So I'm going to be talking about the specialty at the postdoctoral fellowship level. I contributed to the group specialty petition mostly through the experience that I had running a program that trains in group psychotherapy at the postdoctoral level. And that program resides at the University of Nevada, Las Vegas, specifically at the PRACTICE, which is our community mental health training clinic. And so we have a lot of opportunities there for the postdoctoral fellow to train and provide supervision and have exposure to didactics and really put together all the elements of a successful training program. Because of the postdoctoral fellowship program, we've been able to build a very robust group psychotherapy program. The program started back in 2012. That's when the clinic opened, and occasionally I would run, for example, a DBT group or a short-term process group type thing. And that has really evolved and gained substantial momentum once I was able to create a postdoctoral fellowship position. So now we have a group program that serves both children on the youth end and adults. I mostly focus the postdoctoral fellowship with the group specialty focus on the adult program. And so at any time we have between 5 and 6 groups running. So I'll get more into that in a moment. I think the way that I wanted to talk about this is really grounding it in what the specialty petition discusses in terms of a postdoctoral fellowship program that would meet requirements for providing a specialty. And so that really takes into combination a couple things. If we are training at the postdoctoral level in psychology, of course we want to provide some general training. Somebody should leave that position ready to practice in a variety of ways. And we're also infusing the experience with specialty training, in my case with group psychotherapy. And so I really designed the postdoctoral fellowship program at our clinic with these intents in mind. So the program prepares trainees for independent practice, right? By the time that they finish their postdoctoral year, or sometimes I have them for 2 years, my hope is that they are licensed or ready for license eligibility as a doctoral level psychologist. So a lot of the design of the program is ensuring that they get adequate direct hours, adequate supervision hours, and then of course adequate experience in order to really necessitate and establish that they can go on to practice independently. Obviously, I have a huge investment in group as a specialty, and so a lot of our effort is goes into that specialty training. There's a couple of pathways that an individual provider, an individual psychologist can become credentialed. And so there's one through ABEP, which would be your board certification in group psychology and group psychotherapy. And the other is through the American Group Psychotherapy Association, which is a CGP, or a certified group psychotherapist. So a lot of what formed this program was taking a look at what is required to obtain those credentials and ensuring that the training opportunities that my program provides would really prepare someone to be able to be eligible for either of those credentials. And then of course, as I said, we have to ensure the basis of understanding and practice in our field. And so the general training aligns with the APA standards of accreditation. And then as you can see, there's a way that we've integrated the specialty training into those skills and or supplemented some of the general skills with some more specific skills. So again, returning to precisely what we mean when we talk about meeting the requirements for specialty. One of the things that a program should do is really have a clear objective to train in group psychology and group psychotherapy. And so if you look at the job ad for my postdoctoral fellowship program, it very much speaks to our intention to train someone to specialize in group psychotherapy. And so it's not just happenstance that somebody picks up group experience along the way through this particular training program. It's really what the program was specifically designed to do, and it's one of the primary objectives really of our training program. We also look at how much time the resident or postdoctoral fellow is spending related to the specialty. And in our case of our training program, my group specialized postdoctoral fellow definitely spends at least 80% of their time on group-specific work. Oftentimes, my group postdoc may carry a couple individual therapy cases, but even those cases are usually group patients who can utilize their individual therapy actually to amplify their experiences in group. So I'll get into a little bit of what my trainees' day and responsibilities look like so that you can get a sense of how this 80% is compromised. So as I mentioned, our core program consists of a variety of groups catered to adult populations. It's really a program that's designed so that, as a community mental health training clinic, we're trying to be able to meet the demands of our community. And so the program was designed with the intent that your typical patient coming in for services would be able to be served via one of the groups that we offer through evidence-based practice in a way that would really help them meet their treatment goals. And so what that looks like in specifics is we have a couple cognitive behavioral therapy groups, one in the afternoon and one in the evening for some schedule variability. And so if you have someone entering the clinic with depression, anxiety, maybe they've not had treatment before, but acute symptoms, those are patients who are usually going to be really good fits for those CBT groups. And so the postdoctoral fellow is responsible for those groups, as well as our other skill-based groups. So in addition to 2 CBT groups, we have 2 dialectical behavior therapy groups, 2 DBT groups. So those are going to be for our patients who come in with more obvious evidence of emotion dysregulation. Perhaps they're engaging in self-injurious behavior, there's suicidal ideation or substance use, any of the things that would lead one to see that their distress is manifesting through ineffective coping. And so again, we have one in the afternoon, one in the evening for scheduling variability, and my postdoctoral fellow runs those groups. In addition to that, we have a group for severe mental illness. We call it our SHINE group, which is supporting healing in new endeavors. And that is a group that meets in the afternoon, and we're able to meet the needs of some of our patients with severe mental illness, often who need more case management, access to social services, ongoing care, integration with other providers, and so on and so forth. And so the postdoctoral fellow is also in charge of that group. In addition to that, we do run an interpersonal process group. That's usually a group for folks who are generally well functioning, but looking to improve their relationships or their understanding of self, some of the higher level needs that someone may approach for psychotherapy. And that's a group that I co-facilitate with the postdoctoral fellow to ensure that the postdoctoral fellow is gaining experience doing group, but also getting pretty extensive direct supervision and interaction on things like group dynamics, group structure, stages of group, ethics in groups, and all the things that we'll be talking about today as I tell you more about the program. And so they're doing all those groups. Typically, there's different opportunities for specialty groups to come out throughout the training year. So for example, my postdoctoral fellow, I believe last fall, ran a short-term group for professional women that was based on Brene Brown's Shame Resiliency curriculum connections. Right now, well, at least before the pandemic occurred, we were doing an interesting program for a medical school. They wanted us to provide some psychoeducation and drop-in hours for their students. And so my postdoctoral fellow was in charge of building that program and delivering it. So that's the core of the clinical work that my postdoctoral fellow is doing. In addition to the actual hours in the room doing those group psychotherapies, we're also running a training program, and so the postdoctoral fellow is acting as a supervisor to the junior colleagues, usually practicum students or students training in clinical mental health counseling at the master's level, school psychology students, clinical psychology doctoral students. And so we've built out time before and after each of the groups, which is for group preparation, for supervision, for group debrief, for progress notes, and all of that. And so really each group is taking about 3 to 4 hours of the postdoctoral fellow's day. So already that starts to build quite a bit of their schedule around our group psychotherapy program. Of course, then we have additional didactics and supervision, all of it which is largely focused on group psychotherapy, since that's primarily what the fellow is doing. And then, of course, we have intakes, referrals to process. We have cases to round on, pre-group orientations to do, case management, program design, making sure all the pieces are coordinated, and the postdoctoral fellow is heavily involved in all of those tasks. And so it really, I would say anywhere from 80 to practically 100% of the postdoctoral fellows program in my training program is spent related to group psychology and group psychotherapy. One of the other requirements is that to train the postdoctoral fellow, the supervisor themselves has to be specialized. That doesn't necessarily mean that the supervisor has to have one of the credentials that I discussed, like the Certified Group Psychotherapy or CGP or ABEP certification group. Although those things are helpful and would directly communicate those requirements have been met. They could also, meet the requirements that underlie those credentials. And so in my particular case, I am a CGP, and then I'm nearing the end of my process toward board certification through ABEP. But even before I had earned those credentials, I had documented my own experience of group psychotherapy, acquiring the didactic knowledge through coursework, acquiring experiential hours, acquiring supervised hours. And so it is important that you have supervisors who themselves are specialized in order to provide training, which I think makes sense. The program also necessitates an evaluative process, not surprising, pretty standard for any sort of training program, as well as policies like grievance policies and due process and all of those things. Being housed within a university in a training clinic that's fully immersed in training, we had a lot of those pieces in place and just needed to amplify them as we created our postdoctoral fellow handbook that really articulates and communicates, of course, all the various procedures and policies. The evaluation process I'm going to get to a little bit later. There is an evaluation form that's included in the specialty petition that I utilize. And what I like about thinking about it that way is that evaluation really grounds us in what we're there to do as trainers, which is to amplify somebody's ability to meet competencies, right? We are really there to ensure that someone is able to competently practice. And so everything we do at the clinic is anchored in what are the competencies that we are trying to have our trainees achieve. There's also a time requirement, and so to meet the specialty, you would want to have a full-time, 40-hour-a-week, year-long postdoctoral program, or you could have someone do it half-time, 20-hour-a-week for 2 years. I'm fairly fortunate. We've been able to secure funding for our program. It started as a 1-year training program, and my first several cohorts were 1-year postdocs, which adequately prepared them for licensure requirements. We've been fortunate with some funding now and seeing the growth that occurred in the clinic and how many more patients we're able to serve with high quality services because of the program. We're able to fund our postdocs now for 2-year terms. Overall in the clinic, we have 3 postdoctoral fellows, 2 specialize in children and women's health, and then 1 specializes particularly in group psychotherapy. This is where we also get into a little bit about the various levels of specialty training. All the postdocs at least have exposure to the specialty. So my postdocs that work in women and children's mental health, they're really responsible for the youth psychotherapy, youth group psychotherapy program. And they do attend didactics and group supervision on group psychotherapy. But they're certainly not spending nearly as much time as the postdoctoral fellow who is designated as receiving that specialty training. And so even though it's not required for the specialty to have those 2 years, we've mostly been able to do that, again, because the funding is there and it really allows for some consistency in the program. Having the postdoctoral training program has really allowed me to amplify to just, I mean, the whole endeavor of being able to train at the graduate level in group psychotherapy is exponentially increased. And again, if you look at our patient populations and who we're able to serve, that as well has grown exponentially as we've grown our group psychotherapy program. And so having the postdoctoral fellow able to stay in that position for a couple of years has really allowed that consistency, so that now we're training, you know, every semester 15 to 20 graduate students in group psychotherapy across disciplines. So one of the things that is important as you're training in specialty is ensuring that the trainee is receiving sufficient experience. So we're certainly interested in things like population diversity. We're fortunate in my clinic as a community mental health clinic. We serve a pretty diverse population being located here in metropolitan Las Vegas. So in terms of race and ethnicity, we still see quite a few, large segment, about 1/3 of our population is white. We have a high Latinx population, about another 1/3. And then we certainly serve Black patients, Indigenous patients, Asian, Pacific Islander, and really Middle Eastern, and so on and so forth. So in terms of race and ethnicity, we do have diversity there. I spoke a little bit about age diversity. Basically, among my postdoctoral fellow who serves adult populations, you go anywhere from the college population to older adults. I talked a little bit about diversity in terms of presenting problems and diagnoses. Our program is designed to cover a broad range of that, so the postdoctoral fellow is getting experience with diversity in those regards. We're also fortunate to serve quite a few, diversity in terms of gender identity, including male, female, gender nonconforming, gender fluid, transgender patients in our clinic. Sexuality, religiosity. Las Vegas is a place with a high degree of Church of Latter-day Saints, and so there's some specific training in working with those populations, as well as working with secular populations. So we're really thoughtful across the board about how diversity is represented. And again, with those special topic the special topic groups that the postdoctoral fellow often creates during their postdoctoral year, oftentimes those are catered to special populations. So I talked about, like, women professionals was a population recently served, or medical students. In the past, one of those groups became a emerging adulthood among gender and sexual minority young adults. And so we're very intent on trying to diversify that experience. The women and children postdocs, for example, right now run a training program for Spanish-speaking services, and some of the groups that we've offered have had Spanish-speaking opportunities. So wherever there's opportunity to ensure diversity in population, we certainly try to make that happen. I also talked a little bit about how the postdoctoral fellow I train has varied experience in the types of group that they're doing. So if you look at our SHINE group for severe mental illness, you're going to see a highly structured, very psychoeducational group, kind of hybrid with a super supportive model. And so, for example, one of the gifts that that group gives our clinic is they take care of the plants. And so you know, it sounds like a minor thing, but that gives some of those patients a sense of purpose, a reason to come in next week, since a lot of them struggle with a lot of life circumstance that can make it very hard to get to our campus and show up for group. And we've literally had patients say that they made it that day because they knew the plants needed watering. Which is going to look, of course, very different than the interpersonal process group that I mentioned before, which is going to be pretty pure process, no structure, very interpersonally focused. And then we kind of have our groups in between, CBT, DBT. You know, again, based on the postdoctoral interests, we've run grief groups or other specific training groups, outreach groups. And so the idea is to really sit down with the postdoctoral fellow, take a look at their training plan, discuss what their goals are, and figure out how to incorporate these various activities to ensure that they're meeting the competencies and goals that they have for themselves. Of course, they're also accessing multiple skills. So obviously, they're conducting group psychotherapy as an intervention. I mentioned before, they're also potentially doing individual therapy, sometimes adjunct therapy, or you know, therapy, concurrent therapy with patients who they see in both group and individual therapy, and getting training in the specifics of that. They're also, of course, gaining experience with crisis intervention, as that inevitably happens throughout their training year, with supervision, both as the recipient of supervision and perhaps more importantly in the postdoctoral year, being a provider of supervision. They're gaining skills in assessment. You know, how do we assess our group psychotherapy patients? How do we you know, do a proper intake, make sure they're aligned with a group that has likelihood to work for them? How do we track their progress? How do we conduct both formal and informal assessments of our group patients? So again, all of these skills are usually with a flavor of group. So how do you handle crisis intervention as it unfolds with a group psychotherapy patient? And then, of course, consultations. And so they're often speaking at case rounds or treatment team meetings, talking about appropriate group referrals, educating either their peers or other faculty members or the students about group psychotherapy and its effective use, and so on and so forth. So I've spoken a lot about this, but just to be specific about some of the procedures and techniques that you would expect a training program to have, and we have in ours. Certainly the postdoctoral fellow is gaining experience in intervention. We also talk about ensuring that they gain experience in group program coordination. So it's pretty much inevitable that if you're running a group psychotherapy program, there's going to need to be coordination. You know, who's facilitating that group? How are referrals being managed? How are folks moving from one service to another? And all of that requires a decent amount of administration. Those are jobs that tend to be in high demand, and so it's important to me that the postdoctoral fellow who I train has a sense of how is this program designed, how is it run, how is it maintained, how do we ensure that there's enough referrals coming in so that our groups continue to have enough patients to run, how do we assign patients to particular groups, how do we wrap up their services, how do we coordinate with other treatment providers, and so on. And here again, consultation and collaborative care. I think a key factor, and the research supports this, to a successful group psychotherapy program is ensuring really positive attitudes throughout the agency about group psychotherapy. I mean, this is something that has evolved over time in our own clinic. It used to be that, you know, group was kind of the option that maybe you could talk somebody into, or if somebody called, you know, they might hear somebody on the phone say something like, well, we don't have any individual therapy available, but we could put you in group, which is not a referral that most people would jump on. And so a lot of what I train the postdoctoral fellow in is, how do you provide good consultation? How do you get other folks excited about group psychotherapy and its ability to meet the demands of, our current crisis in mental health here in this country? Certainly ethics are front and center, and of course, group psychotherapy folks know that ethics can show up in some interesting and complicated ways when you're doing group psychotherapy. And so a lot of what we're doing is ethical decision making, and then of course training the more junior colleagues on that process as well. So in terms of evaluation, as I said, evaluation should be grounded in competency. This is the postdoctoral group specialty competency evaluation form that's included in the specialty petition, and the one that I use to rate my postdoctoral fellow who specializes in group. And I also think that this is helpful to routinely return to as a supervisor, as a trainer, to remind myself what the goals are, what my training program is about, what I'm doing on a day-to-day basis to help really instill these competencies in my trainee. And so you'll see the first domain falls into the integration of science and practice. And here it's group specific, right? So we talk about group organization, research related to group members, problems, issues, and concerns, and of course the evidence base for planning and facilitating groups. Then there's a domain related to ethics, and the next domain is about consultation and evaluation. In particular, when we're doing group work, we're often called upon to be able to work in interdisciplinary teams. And we have expertise that lends ourselves well to being able to facilitate that sort of work. Here it also talks about things like group cohesion, group progress, and so on. Under supervision and teaching, we do ask our trainees to apply a supervision model and to be able to present information related to group psychology and group psychotherapy in various venues. We do ask them to be competent in group-specific assessment, utilizing existing measures like the group questionnaire or routine outcome monitoring systems that are made for group, and be able to apply those. We're also, of course, evaluating professional values, attitudes, and behaviors related to psychotherapy. I think with group psychology and group psychotherapy, the self-reflective process is key. We talk about the understanding and application of intervention, again, along the lines of group-specific competencies, like dealing with problematic group members and managing safety within the group. And then, of course, individual and cultural diversity. Group psychotherapy is rich ground to bring together diverse identities, intersectional identities, and to be working towards social justice. And so we are attending to those issues very regularly. And then you'll see at the bottom here we are specific about the minimum requirements, including one direct observation, one written, and one orally presented evaluation form. I definitely go well above that. As I said, I facilitate weekly with my postdoctoral fellow, so there's plenty of direct observation, and there should be ongoing formative evaluation and then a summative evaluation. I tend to, because I'm at a university, do summative evaluation on a semester schedule. So at the end of the fall semester, before winter break, at the end of the spring semester, and then at the end of the summer before going back into fall. And then successful completion requires minimal ratings of 4 in all the competencies. And if we go back up, you'll see that a 4 would be good. Of course, you would expect to see most postdoctoral fellows with scores above 4 on most of these dimensions, but you certainly wouldn't want to pass someone along if they weren't at least getting 4 on all of these. And then it talks about here, what are the outcomes that we're striving for? So again, the goal of my program, we want people to be qualified to be credentialed in group psychotherapy, to be licensed at the state level, to be able to function in an advanced capacity as a group psychologist. And we go ahead and grant them a certificate when they complete our program, as well as supervision and teaching. And so again, we have a model in place where I'm directly supervising the postdoctoral fellow, co-facilitating that group to provide those live observations of their work, engaging with them in the pre and post group time, as well as having a distinct hour outside of that for one-on-one supervision. I'm in charge of the group supervision of group psychotherapy, which is when we get all the facilitators at all the training levels, as well as the postdoctoral fellows together in the same room to often provide didactics, but also do some case discussion and debrief. So then the postdoctoral fellow is, in that vertical model, again, providing supervision to junior trainees. In the case of our group psychotherapy postdoctoral fellow, that postdoctoral fellow is often also providing consultation and or supervision to the other postdoctoral fellows at the clinic who may not be getting as much experience in group when they have questions or cases that it would be helpful to have more expertise on group. We also look for opportunities to involve the postdoctoral fellow in teaching. So for example, annually, the UNLV School of Medicine Psychiatry Department asks us to do a series on group psychotherapy for their psychiatric residents. And so my postdoctoral fellow is often able to take up that opportunity to provide some formal teaching. I teach a group psychotherapy class to graduate students through UNLV. And so in summers when that program is running, I often have the postdoctoral fellow co-teach that with me. It depends a little bit on the postdoctoral fellow's incoming experience and knowledge base, whether they'll be more a recipient in that course or a co-teacher. So for example, if someone came in with experience but not the core knowledge base, maybe they had never had coursework in group psychotherapy, then they would informally audit that course. But I would be in charge of evaluating them through that process to ensure that they do have the knowledge base that is required for the specialty. If they did come in already having met those requirements, then I'm going to look to them to help me more with the formal teaching of group psychotherapy. So that pretty much concludes what I wanted to say about the postdoctoral training program. I think what I'd like to highlight, if it hasn't come clear already, is that I found it just so invaluable to have created this program. What it's allowed us to do and who it's allowed us to serve has just been really beyond what I ever would have expected. And as someone who in some ways was kind of an island of group psychotherapy at my university, this is really bringing in a postdoctoral fellow kind of created a tide. And now I don't feel that way at all, right? The energy has been contagious. And so I think if this is something that you're thinking about doing, there's a lot of hope there. So I appreciate your time.